Today, we're delving into a topic that demands our immediate attention: bowel cancer. Did you know that in the United States alone, over 150,000 new cases are diagnosed each year? But here's the real eye-opener. There are 7 critical symptoms that could signal a potentially life-threatening situation, requiring urgent investigation. Stick around as we uncover these warning signs and learn why prompt action could be the key to saving lives. Number 7. Persistent change in bowel habits, such as diarrhea or constipation. The digestive system is a complex network of organs, including the colon, which plays an important role in processing waste and absorbing nutrients. Any disruption in its function can be a cause for concern. A common symptom that may indicate a problem is frequent changes in bowel habits. This may manifest as diarrhea or constipation. According to the American Cancer Society, while changes in bowel habits can be caused by a variety of factors, they can also be a warning sign of colon cancer. Colon cancer often develops without symptoms in the early stages, so routine screening is very important, especially for individuals over the age of 45. Screening methods such as colonoscopies can detect precancerous polyps or early-stage cancer when it is most treatable. Remember, early detection is the key to successful treatment. If you're experiencing persistent changes in bowel habits or any related symptoms, don't hesitate to consult your healthcare provider. Number 6. Blood in the stool or rectal bleeding. Blood in the stool or rectal bleeding. Is this a sign of colon cancer? First, it's important to understand that while blood in the stool can be worrisome, it doesn't always indicate colon cancer. However, it's definitely a symptom that warrants attention and further evaluation. Colon cancer usually affects people over the age of 50, although it can occur at any age. If you are experiencing rectal bleeding and are over 50, it is especially important to seek medical advice. Along with rectal bleeding, colon cancer can be accompanied by symptoms such as changes in bowel habits, persistent abdominal discomfort, unexplained weight loss, and fatigue. If you are experiencing these in addition to rectal bleeding, it is important to consult a healthcare professional immediately. Certain factors increase the risk of developing colon cancer, including a family history of the disease, a personal history of inflammatory bowel disease, a sedentary lifestyle, obesity, smoking, and heavy alcohol consumption. Regardless of the cause of rectal bleeding, it is important not to ignore it. If you notice blood in your stool or experience rectal bleeding, it is important to consult a healthcare professional for a proper evaluation and diagnosis. Number 5. Persistent abdominal discomfort, such as cramps, gas, or pain. Many of us experience occasional stomach problems such as cramping, gas, or pain, often attributed to something we ate or stress. However, when these symptoms persist, these could be signs of something more serious, like bowel cancer. Bowel cancer, also known as colorectal cancer, is one of the most common types of cancer worldwide. It usually develops from precancerous polyps in the colon or rectum and causes a variety of symptoms, including persistent abdominal discomfort, can manifest in different symptoms. However, experiencing persistent abdominal discomfort, especially in combination with other symptoms, such as changes in bowel habits or unexplained weight loss, should warrant further investigation. Early detection is key to successfully treating colon cancer. Screening tests like colonoscopies can detect precancerous polyps or early-stage cancers when treatment is most effective. If you have persistent abdominal discomfort or any related symptoms, if you're experiencing it, don't hesitate. Consult your healthcare provider. Remember, your health is precious, and addressing symptoms quickly can make all the difference. Stay informed, be proactive, and take care of yourself. Number 4. Unexplained weight loss. Unexplained weight loss can be a symptom that often raises questions about underlying health problems. But could it be a sign of something more serious, like bowel cancer? First, What exactly is subtle weight loss? Well, it's when you're losing weight without even trying. This means there's no change in diet or exercise routine that usually results in those extra pounds. Shedding pounds results. Now, let's address the big question. Could unexplained weight loss be a sign of colon cancer? Yes. Unexplained weight loss can indeed be a red flag for various health problems, including colon cancer. When cancerous tumors develop in the colon, it interferes with the body's ability to absorb nutrients properly, can lead to weight loss. Colon cancer can cause a variety of symptoms, including changes in bowel habits, abdominal pain, and even bleeding. These factors, combined with the body's efforts to fight the cancer, can cause hunger and subsequent weight loss. It's important to know that unexplained weight loss can have many causes, ranging from benign to severe. However, it's important not to ignore it, especially if it's accompanied by other associated symptoms. If you are experiencing unexplained weight loss or any of these symptoms, it is important to consult a healthcare professional immediately. Early detection and treatment are important in the effective management of bowel cancer. Number 3, constant fatigue or weakness. Fatigue is a common complaint, but when it becomes persistent, it can signal something more serious than sleep deprivation. Bowel cancer, also known as colorectal cancer, is one of the most prevalent cancers worldwide. It starts in the colon or rectum and can develop over time. An under-recognized symptom of bowel cancer is persistent fatigue or weakness. While fatigue can be caused by many factors such as stress, lack of sleep, or poor diet, persistent fatigue, especially when accompanied by other symptoms such as unexplained weight loss, changes in bowel habits, or blood in the stool, could. Red flag for bowel cancer. If you are experiencing persistent fatigue, along with any of these symptoms, it is important to consult your healthcare provider. Early detection is critical to successfully treating colon cancer. So don't ignore persistent fatigue, listen to your body, and seek medical advice when needed. Number 2, a feeling of incomplete emptying after a bowel movement. Have you ever experienced a feeling of incomplete emptying after a bowel movement? This is a common concern for many people, and it can be quite upsetting. But does this feeling indicate something more serious, like colon cancer? Let's dive into the facts. First, let's figure out what's causing this sensation. Incomplete emptying can be attributed to a number of factors, including constipation, dietary habits, and even stress. It is important to note that bowel cancer is one of many possible causes. However, it is important not to ignore persistent symptoms. While incomplete emptying alone is not a sure sign of colon cancer, it is important to pay attention to accompanying symptoms. If you're experiencing these symptoms, it's important to consult with your healthcare provider. Early detection is critical to effectively managing colon cancer. Remember, while the feeling of incomplete emptying can be uncomfortable, it does not mean you have bowel cancer. Stay informed, listen to your body, and seek medical guidance if needed. Number 1, anemia, a condition characterized by a lack of healthy red blood cells, can occur for a variety of reasons. But could it be a warning sign of something more serious, like bowel cancer? Let's find out. First, let's understand anemia. Symptoms can include fatigue, weakness, pale skin, and shortness of breath. While anemia can stem from nutritional deficiencies or other health problems, it can also be a red flag for underlying conditions, such as bowel cancer. When a patient presents with anemia for no apparent reason, we consider the possibility of gastrointestinal bleeding, which could be from colon cancer. Bleeding from the digestive tract can be subtle and unnoticeable, which can lead to severe anemia. Bowel cancer develops silently, often without noticeable symptoms in its early stages. However, as it progresses, it can cause changes in bowel habits, abdominal pain, and yes, anemia. Therefore, if you or a loved one is experiencing anemia, it is important to consult a healthcare professional. They may recommend further tests, such as a colonoscopy, to rule out more serious conditions such as colon cancer. In conclusion, recognizing the signs of bowel cancer is crucial for early detection and treatment. If you or someone you know experiences any of these 7 symptoms, persistent changes in bowel habits, blood in stool, abdominal pain or discomfort, unexplained weight loss, fatigue, rectal bleeding, or a feeling of incomplete bowel emptying, it's vital to seek urgent medical attention. Remember, early detection saves lives. Stay informed, stay proactive, and prioritize your health. Thank you for watching, and together, let's spread awareness to fight against bowel cancer. Subscribe for more informative content, and don't forget to share this video to help raise awareness in your community. Stay healthy, stay vigilant. Goodbye for now, and take care.